Hello, All-Star listeners, and welcome to a very special episode of the Veterinary Roundtable, presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice, and if you have any feedback to offer to improve the Veterinary Roundtable, let us know. If you have a question, icebreaker, or topic discussion for the Veterinary Roundtable, send it to harrison@all-starvet.com. Now, one thing we have to talk about before we get started completely is the book, the Chowder book, Chowder Caught a Cold. So we're very proud of this book. It can be found on Amazon, and it has Kindle versions. It's great for children pre-K to third grade. It's a veterinary children's book written by our own Dr. Kristen Puls and illustrated by our own registered veterinary technician, Josie.
Yep.
Ellis Devaney. I call her Devaney, but it's not her, that's not her married name. So, and they did an amazing job. So we just have to show some pictures before we
see what happens to Chowder. The suspense.
And I keep telling them, I'm like, Chowder's going to have a career because it's really cute. They did a really good job.
The illustrations, everything. It's very
fun to read.
Simplified, but great.
Yeah.
Great for the young minds.
So check it out.
Yep.
All right, Duckwall.
Okay. On today's episode, we have myself, Associate Veterinarian Dr. Ashlyn Duckwall, my co-host, my partner in crime, the hostess with the mostest, Dr. Emily King, and our very special guest. He grew up on a small farm in Virginia with an exposure to a number of large and small animals. His father, who is also a veterinarian, significantly contributed towards his veterinary path. He obtained his DVM and master's degree from Virginia Maryland Regional College of Veterinary Medicine in 2005, where he met his wife, who is also a veterinarian. After a year in small animal general practice, he then went to complete his small animal rotating internship in Albuquerque, New Mexico in 2007, before completing his small animal surgery residency at University of Minnesota in 2010. Please welcome Dr. Brian Martin. Woo!
Okay.
We're so excited.
Thanks for having me here.
Thanks for coming. How are you doing today?
I'm doing very well.
Yeah. Okay. Ready to talk?
Let's do it.
Okay. Well, we always start with some icebreakers.
Okay.
That we at least find entertaining. Okay. So first one, what kind of qualities did your favorite teacher have and what made them special?
Ooh, that's a good question. Qualities. It's easy for me to come up with my favorite teacher. So this was my math teacher in high school. It took a calculus class. Her name was Miss Maddie. And most people don't get super excited about math, but she got us excited about it.
Yeah.
It was a subject that she was passionate about. So I think as far as qualities for what made her a good teacher, she imparted that excitement to us. She was also very fair, meaning she wanted us to learn the material, not so much for a grade, but to understand it and learn it. And then third, she was actually quite difficult. So it was a very hard class.
Yeah.
But it made it enjoyable, especially when you did well. Because
you knew you earned it.
Yeah.
Right. And you wanted to, in some ways, please her for that reason.
Yeah.
So you like a challenge.
I did.
Yeah.
Yeah. And
Put it face on.
Like a challenge.
Yeah.
But I also like to enjoy doing that at the same time. So had it been hard and not enjoyable, I think that would have been...
Yeah.
I wouldn't have listed her on this.
Yeah.
Segment.
What about you,
she did
Doug?
something right.
Yeah, she was quite good.
Yeah.
So Miss Maddie, if you're out there, thank you.
Thank you, Miss Maddie.
Thank you, Miss Maddie.
Yeah.
I don't know. I think I kept it general because I had a lot of just good teachers that I don't have like one specifically that like really altered my education course, I would say. But in general, all of them, like, they're fun, made the learning fun. They also, I guess one of them was like a writing class. And so kind of let us express our own interests and stuff like that. And like obviously helped us, but also was like, oh, that's really cool, like in middle school and stuff like that. So fun, entertaining, but then also helpful and let us just kind of do our own thing.
Yeah.
I don't know. It's very generic.
No, I mean, it applies.
Really
I think that's probably, the person I was thinking of, it was a history teacher in high school that, history is, like if you either like it or you don't. And I was kind of like, whatever, I have to take this class. But this guy would act out the different parts. So he would like come dressed up as something, or he would bring props in to show you like, okay, we're talking about the Civil War. This is the kind of, back then you could bring a gun into class. This is the kind of gun. This is an old revolver. This is what they use. This is why they used it. This is what da-da-da-da. Or he would dress up like, one of the characters and whatever. And again, he made it entertaining, right? So, and I think people that are passionate about what they're teaching about, you can really tell. And those are the people that I would think students would gravitate towards to learn. It makes the learning a lot easier.
Yep.
Equally on the other side of the fence, you can tell the people that hate their jobs.
Yeah.
So
even today, mentorship and stuff, like you want someone who wants to be there, but then is excited to share the knowledge.
Yeah,
so,
for sure.
I find it interesting. We all listed a high school teacher. So
yeah.
That's a lot of impressionable years.
Yeah, I was gonna
it
say,
is. It really is.
A lot of development in those years.
Absolutely. Oh, gosh.
All right. Number 2, what vegetable is best paired with cheese?
Am I going first?
Yeah.
Now, the question really is, are we hiding the vegetable with cheese or are we accenting the vegetable with cheese? Because my
Don't
answer
we
would
always
be
try to
different.
hide it with cheese anyway? Like, isn't that the point?
Cheese is the better part of the equation, right?
Otherwise, you wouldn't put cheese on it. So,
are you putting it on it, or do you eat a piece of cheese and then eat a vegetable?
I've never.
You're putting cheese on the vegetable.
Yeah.
Okay.
And melting it.
A second.
And
you're melting it now.
You don't take a clump of cheese and then a cucumber and then go.
I'm thinking like cheese cubed. You're thinking melted cheese.
Oh yeah, right. I was thinking sprinkling cheese on top. Oh, now see this.
So that's
question
this is
okay. So take it however you interpret it.
Well, if I was to hide it, zucchini.
Okay.
Nobody wants a plate of zucchini.
Yeah.
So
cooked zucchini or raw zucchini?
Well, bury it in butter, breadcrumbs, and cheese.
And cheese.
Yeah, that's delicious.
And then you can still say it's good for you.
Yeah. Because it's green.
Yes.
But if I was to put a little bit on there, I like roasted cauliflower.
Okay.
Like with some olive oil and a little Parmesan.
Yeah.
There you go.
I do like
That
roasted
sounds
cauliflower.
Good. Yeah.
Harrison
I like
likes
cauliflower in general.
You don't?
I do.
Oh.
I do.
Yeah.
I like to eat it with ranch.
There you go.
Just
I don't know if I like it raw.
Oh, I like cauliflower raw, but I got to dip it in ranch dressing.
Yeah.
But if you ever make cauliflower,
ranch.
yeah, exactly. If you ever make cauliflower, like buffalo cauliflower,
Oh yeah, that's really good
it's
too.
really good.
Yeah.
I like buffalo sauce.
Anything
though.
flavored on veggies, essentially.
I know.
Yeah.
What would you say? What would be yours?
I just do it most often with broccoli, like sprinkle cheese on it and then melt the cheese. Just did this weekend. So that's my first thought. That's how I interpreted it.
Okay.
Yeah. Sprinkle some flavor.
I would say potatoes.
Yeah. See, that's a good one. I thought
It's hard to eat a potato without some cheese.
Yeah. Especially a baked potato.
Unless it's a French fry.
Yeah.
Yeah. Yeah.
Then you have those loaded fries. Those are really good.
That's true.
Then you got to have bacon. It's a whole thing.
I know.
I'm just thankful we all. Like if I couldn't eat cheese, I think that'd be difficult too.
Oh my gosh.
Oh, yeah.
If I was dairy intolerant for some reason.
God bless all those people out there in the world who are. Like, seriously. It takes a lot of courage.
Oh, gosh.
Okay, so now we're on to the fun stuff. We're going to ask all sorts of questions.
Sounds good.
Okay. So first, we'll just start by tell us about yourself. Like, what made you pick surgery as a specialty?
Sure. Those are two different questions.
Mm-hmm.
About me a little bit outside of the profession. So been married 21 years and I love it. And we have 3 daughters. So 15, 13, and 11. Madeline, Eva, and Hannah. So house full of women.
Yeah, you are.
I love it. And
That's awesome.
we're pretty, I wouldn't say we're avid outdoorsy, but we're on that end of the spectrum. So we have a canoe. I love to canoe. Spend a lot of time outside, hike and camp, and find ourselves at national parks and those kind of things for family vacations.
That's cool.
So
all your daughters enjoy that as well?
They do to degrees,
Yeah.
but all of us enjoy it.
Okay.
So what else? I've started keeping bees.
No way. Did you?
Yeah.
That's awesome.
I'm relatively new at it, so
Yeah.
this is my second year. So I'm excited about that. Not so much for the honey, but it's just an interesting
Hobby, yeah, for sure.
hobby. So
It's not easy. Like, you have to
No.
learn a whole new ecosystem, right?
well, everybody I talk to, it's a high failure rate initially. Like once you get some established colonies going, then it's a little bit better.
Okay.
But
That's cool.
yet to determine if I've survived everything through the winter. So, I'll find out in about a month.
Okay. We'll follow up.
Yeah.
Yeah.
Now, you said your wife is a veterinarian?
She is. So a general practitioner, works here in Indianapolis area. And so it's nice to have that in common with her. So she very much understands my aspect of work and some level of detail that I think a lot of partners don't have that. So very thankful.
Yeah, that's awesome.
Mm-hmm. So she's married younger and smarter. So she was a year ahead of me in veterinary school and met her there. That was actually the last thing I wanted to do was marry a veterinarian. But I met her and then I couldn't help it. So.
That's right.
So do you have a lot of animals too or no?
No, I have about 100,000 bees.
Okay.
Yeah, that's right.
Each individually. But no, we just have one dog, a long-haired dachshund named Tagalong.
Tag along. That's so cute.
That's what he does.
Yeah.
So he's a little red, long-haired dachshund.
That's cute.
And one fish.
Okay.
So there you go. So not a
Pretty
huge...
low key.
Yeah, not a huge...
Menagerie.
I grew up with that and it was really chaotic and it was all outside. Just don't really have the space for it, I think, to do that right now.
What farm animals do you have outside?
Mostly goats.
Okay.
We had about 40 goats at one point.
Oh, wow, yeah.
So was your dad large animal then, veterinarian, or mixed, or
Small animals.
small animal?
Okay.
But he just liked to have large animals.
He did. So we ended up having some cows at some point, horses, a lot of goats, and dogs cycled through our place too. It was great. It was an awesome way to grow up.
Yeah.
Mm-hmm.
Yeah.
So it's in the Appalachian Mountains. So I got to hike the AT a fair amount. And
That's cool.
That's pretty cool.
probably what led to outdoorsy stuff and kind of the veterinary direction as well.
Yeah. Yeah. It sounds like.
Well, that area of Virginia is so cool.
It really is.
Yeah.
I have to be careful to say Western Virginia because then everyone thinks I'm from West Virginia.
Mm-hmm.
So I grew up in Virginia.
In Virginia. That's right.
Just to clarify.
A lot more hilly than here.
It is. I do miss the mountains a little bit, but weather is almost identical as far as having a solid 4 seasons. And that I don't mind at all. I like that.
That's good.
Mm-hmm.
That's good.
And people are quite nice and down to earth.
So what made you pick surgery then?
Yeah.
Surgery. Oh, I didn't initially. I actually practiced in general practice my first year. Honestly, because I was tired of school. I was like, I don't know that I want to do
Keep
anymore.
Going, yeah.
Yep.
But I realized pretty quick I wasn't smart enough to be a good general practitioner because you have to know lots about every single thing. And I always had an interest in surgery. And so that was kind of a pull that direction. But it was confirmed pretty quick that first year in practice out of school that I found myself wanting to go to the OR all the time. And I actually found a hospital that was very heavy into they're doing their own surgeries and felt like I could learn from that. And then quickly realized I wanted to do that all the time.
All the time.
And had to sit down and have the hard conversation of, hey, I want to go back to school. Hopefully this is a good reason to leave. And fortunately, it worked out because I don't think it works out for everybody that wants to go the surgical direction or any specialty for that matter. I was just very fortunate and thankful that I was able to land an internship and then get a residency and couldn't have been more happy through that process.
Do you think the majority of people that get internships are from school or do you think when they're putting internships or people into internships, they look for people that have had general practice, like, a certain percent and then a certain percent from school?
That's a good question. I don't know about internships specifically. We had that conversation in residency because I sat on the residency committee for future residents coming through. And I wouldn't say that it was a negative for them to have experience, but I do think a lot of the faculty valued a newer student that they could mold that wasn't already formulated in some certain patterns.
Yeah.
So I'd say the majority of students out of veterinary school will go directly into internship and then ideally directly into residency. But with that said, I can name 3 or 4 that took an alternate path and there's some value to that too.
Sure.
Mm-hmm.
Was it hard going back then?
No, not at all.
Really? That's
no,
good.
It was just, if you like what you're doing, then it makes it less difficult.
Yep.
And I really enjoyed that part of it. I found the internship year really difficult because you're just a workhorse. It was a clinical internship. It was not at a university, and it's gone all the time. And I was really ready to take the next step and get into the residency.
Long year.
Yeah, I was going to say, but that's a very long year because they do, just run you ragged.
Yeah.
But I learned a ton. I mean, absolutely. I would encourage any veterinary student that's coming through to do an internship at a minimum. I think that's real important to highly consider that as an option if you have the ability to do that.
Yeah. I feel like it's a nice in-betweener, before going from not really getting hands-on anything, and then all of a sudden you're the decision maker in the first year out, So I don't know. Maybe you could speak to that, but
I think the big job of veterinary school is to teach you how to think and how to solve problems. You can't present every problem to a veterinary student in your fourth year. So having a clinical year in addition, like a internship, that's invaluable to learn how to independently think, but still be under some guidance to get some direction that way. I think that's worthy to consider.
Yeah. It's a grind, just knowing it's going to be a grind, but getting through it.
I don't think veterinary students or veterinarians are opposed to hard work.
Yeah.
No, exactly. That's true. That is very true. So what are some of the challenges of having to work with referral practices?
When you're asking that question, is that working at a specialty hospital, that referral practice, or the relationship between those sending the cases?
I think those sending the cases.
I think that's where we're coming
because we're always like trying to be better. Okay, what things can referral practices do to enhance the relationship, or to
what can we do to lessen the load for them as well?
Okay,
so what do you think are some of the challenges that the referral?
That's a really good question. I'd like to hear the opposite as well from your perspective. I'd probably put it in 3 different categories. One, the appointment, or everything that happens prior to the appointment and appointment day. Second would be like the procedure, at least for surgery, the procedure itself, and then aftercare. So challenges some are out of the control of referral practices, and that has to do a lot with clients. Many times they see multiple veterinarians. And so the information that we receive for an appointment may be incomplete or may not have all the hospitals that they visited. And so I think one of the challenges, not unique to just referral practices, is communication and paperwork.
Mm-hmm.
Makes
I mean,
sense.
if I was to critically examine my own paperwork, it's probably incomplete at times. And so is anybody else's.
Right.
And so there are expectations with each case that you have for me to meet. And it's hard to read between the lines what those are sometimes. So I guess one, incomplete information might be, and then I'm expected to handle that or figure out the problem and then try to solve the problem. And I look at each case having 2 clients, like the person that's holding this companion and then you as the referral partner themselves, because I want both to be happy.
Yeah.
And I'd like to say that we do well with that most of the time.
Oh, yeah.
Yeah. Oh, absolutely.
So that'd be one. I guess procedural wise, sometimes I'll go in a direction that's a little bit different than the referral hospital was thinking, and they've counseled well with clients. And I have to say, this is something that your hospital does quite well. Having seen a number of cases come from many different hospitals, I think All-Star Veterinary Clinic does an awesome job of client prep and case management. So throw that out there.
Well,
Thank you. That's actually really
and it's not just because we're
encouraging
on here, but it's just because it's a true statement, and you can tell that there's a lot of work that goes into that. Probably the last part is follow up, and you don't want to have something go out of the hospital and then assume, the referral partner is going to take care of everything, or I'm going to take care of everything. And so the communication there can be sometimes difficult. If I want to get a hold of you, you're busy just like everybody else and can't jump on the phone right away. And so sometimes things can get lost in translation that way. But I'd say for the most part, that process is not poor.
Nice.
Yeah, I would agree.
Yeah.
Yeah.
I would say from the opposite perspective, I think there, at least me personally, always has a subtle fear of like not educating the owner well enough before sending, and then not meeting their expectation in that regard. So then they're frustrated by the, if you're going a different way or explaining it differently than what I could do, then, I feel bad because I'm not meeting my duty as the referral. So I think that's always in the back of my mind when I discuss referral to any specialty is like, okay, can I go through all the possibilities that would be presented in front of the owner so that they're not blindsided? And then like, what the heck by the time they get to you? I think that would be my biggest.
From my point of view,
thing.
I don't think you need to, though.
Yeah.
You can just tell them. And I think it's okay to say, I don't know.
Mm-hmm.
Yeah.
I think we're often afraid to say, well, I'm really good at, a couple of these things. This is a little bit different. This is why I think we should seek a referral opinion. And they may go a different direction than we've talked about and be okay with that.
Yeah.
They may want to repeat something. They may not. And you don't really have to explain all the differentials.
Yeah. No,
and so I'd probably take some pressure off of yourself in that regard. Just say, this is why we're going to see somebody different to see if we need to go a different direction.
Yeah. No, that's good advice. It's encouraging.
Yeah.
I guess one other thing I'd say too, and not so much maybe here, but other or newer, it's okay to refer. And so if you find something a little out of the ordinary, you don't feel like you have resources and other people that can help. Mm-hmm. And so it's kind of a plug for an early referral.
Mm-hmm.
If we choose not to do something, that's okay.
Yeah.
Right.
Choose to wait.
Well, that's what I always tell people is that just because you go doesn't mean you have to do, and just go and get the information.
Yeah.
It doesn't commit you.
Right.
Yeah.
But it gives you an information to make an informed decision.
Yep.
Yeah.
Mm-hmm.
Yeah. It's very helpful.
Yeah.
I think we oftentimes, we like when people go, especially at this stage in our game. I think with the clinicians that we have working, they're very good at working up cases, especially internal medicine cases. By the time it needs to go to referral, it's like, we end up, sometimes we may not know we may not get an answer. Like it's possible that you go and you still don't get an answer, but you have that person who can't get the answer. Like you've exhausted everything then at that point. Like you could feel good that you don't know the answer, there's no stone that's going to be left unturned kind of a thing.
Yeah. Absolutely.
But it's,
Is this why we call it practicing medicine?
Exactly.
Well, that's true in the human field too. They don't have all the answers either. And, I have a good friend right now that has a significant medical issue and getting various different opinions from specialists, and they don't all have uniform answers. So it's not black and white.
Yeah.
I would say the other thing too is from a referral practice standpoint, just use if you own your own clinic or you're in a clinic, use the same, a lot of times using the same referral practice allows you to build relationships, which then it is easier for you to know how I think, or it is easier for you to fill in the lines because you do know the kind of cases and so we made a decision, okay, we're going to use this facility. We're going to use it solely, so that people can get to know you. But then it's like, oh, okay, Dr. King did an ultrasound. Okay, I can trust this information versus, needing to repeat it because they're not sure, or they, what does this mean when she says this? What does it actually mean? So I think that also really helps if you can use the same people,
I would echo that. Just establishing relationships within the veterinary community. That's really important to do.
It's very helpful.
Different perspectives all the time. Advice. I mean, anything. It's really nice to have that.
Well, at the end of the day, we're all on the same team. Like we want.
Yeah,
exactly.
We want these companions to do well with whatever the problem is.
Yeah.
Yeah.
Okay. So what's your favorite surgery to perform?
Yeah. That's not a hard answer for me.
Yeah.
I love elective orthopedics.
Okay.
So if you're to look at surgery, there's basically 3 big categories. So neurosurgery, and then soft tissue surgery, and then ortho. And I really like elective ortho. And what I mean by that are cases that aren't emergency, life-threatening. So, for example, fractures or cruciate ligament tears. And why I like them, most of these dogs are happy coming in. They're relatively healthy. And you can intervene and have them do well. Mm-hmm. So, of the elective orthos, hands down TPLO. I like it a lot. Not all surgeons do. I think for cruciate ligament tears, it's the best thing out there. Mm-hmm. I think literature is starting to prove that, if you could say that. I know it's been around for almost 30 years, and in my opinion, there's not something better. And I've just seen so many households go back to being active because of it. And I like that. I like to be able to intervene on a problem and see patients do well. Yeah. So there's some level of monotony to doing something repetitively, but I really like the subtlety of the details in that.
That's awesome.
As well. So they're all a little bit different. But there's enough that's the same. And this kind of goes back to, I wasn't smart enough to do everything. So I want to be really good at like a select few of things.
You're right. Yeah. Right. That's awesome.
And that's probably the main orthopedic disease we see.
Oh gosh. I mean,
it is common.
Rear limb lameness, hands down.
Yeah.
Don't you think?
Oh yeah. Absolutely. I've had a lot of slew of elbows lately, but still. It's like,
I feel like that and an itching dog. Like that's
always me.
We just boil veterinary medicine down to 3 problems.
It's like, oh my gosh. Yeah, it's so funny now because even, the appointment will be on the calendar, and then, one of the room assistants will be like, yeah, it's probably cruciate, because it's a rear limb lameness, and they're like, yeah, they were outside over the weekend. Now they're, so it's funny. You can, even they get into these thinking modes of, it's like, now we don't know that yet. Don't assume that.
It's hard not to get
I know it is.
But
well, you can look at it. It's like, maybe that until proven otherwise. But this is where being thorough is helpful too. And
absolutely.
It's not always
as it seems.
Yeah,
it is.
Yeah, that's for sure.
Mm-hmm.
Okay.
So that would be my answer.
Yeah, that was pretty straightforward, easy, huh? Okay, next one.
How's your work-life balance being a specialist?
It's interesting that you would ask that question. I think that's becoming more of a topic, not just as from a specialist, but from outside of veterinary medicine, but particularly in veterinary medicine because of the increase in patient need or veterinary care need, and then the employment issue as well. Not enough veterinarians. But as a specialist in particular, it can be challenging. I've even had to make some significant changes in my own life to create boundaries there. I think as a surgeon, probably the answer has some subtleties depending on different specialties. But at least as a surgeon, so I've been a surgeon now 14 years, and I've probably been on call for half that time. So like every other day, if you kind of look at it that way. And so what that means is at the end of your day, when you're going home, you turn your phone on and wait for someone to call you to come in after hours for some kind of need. And so you're tethered. It does restrict some level of freedom for you, but it is part of what you sign on for. And I knew that ahead of time, but it does wear on you. And it's okay to create some boundaries. So call for me would be one area where I've struggled to find a good balance. Can't say that my life is always balanced, but trying to make it there. The other probably would be with inpatient cases. So what I mean by that, say at the end of your work week, Friday afternoon, you get a case that is critical, like a septic abdomen or a liver lobectomy that you just did that is now not doing well. And well, you can't just send it home. When you're walking out of the hospital, somebody's got to take care of it, and not every facility has someone to hand that off to. And so oftentimes, at least in my experience, that is still me to manage that post-operatively. So even if I'm not on call for that weekend, I'm still up there checking on patients and making sure they're taken care of. So you do bring some work home with you that way, and that's okay. I think the mentality of working like that is healthy. We need to have we want what's best for our patients. But I think the challenge is for each individual trying to find and create some boundaries. So for those that are students or new employees, trying to have that conversation with what that looks like within that particular facility. What freedoms can you ask for?
Mm-hmm.
What are the cultural expectations for that particular hospital? Because they're different from place to place.
Do you think that, are you concerned at all about anything changing with the landscape as far as like fewer and fewer people being willing to do those things? Meaning,
you mean having the mentality of
right.
I'm on all the time?
Or just
or
not that you're on all the time, just like, okay, this is my patient, so I'm going to care for it through the weekend.
Mm.
Do you know what I'm saying? Like versus people, like, do you see that the referral practices are inundated more and more with patient care that really could be managed by the individual hospitals because people want to check out?
Mm.
Do you know what I mean? Like, are there fewer and fewer people being willing to?
I think the answer is yes. I think there are more employees that are pushing for their own advocacy and work-life balance. And what that means is time away and dedicated time away. The challenge for the employer is to have enough employees to cover when that person's out.
Mm-hmm.
So that might mean more veterinarians, or that might mean we didn't have a critical list at this referral hospital before, but now we need one. And that critical list can take a number of veterinarians and train them to manage certain cases when others are out. So I think we need to think differently on both sides of that, from an employer and an employee. But I do think there is a trend, whether it's a fast growing trend of quiet quitting, that exists. It probably exists in veterinary medicine. I haven't really seen that yet, but it probably is there.
Yeah.
I would say
Hopefully,
for staff, for sure, probably.
Yeah.
Oh, yeah, absolutely.
But I think from the professional standpoint, there's a subset of traits that get a person into veterinary school, through veterinary school, and into the profession. And most of these individuals are quite dedicated. So I have a hard time thinking that's going to be a universal issue.
Yeah.
It might be a few outliers here and there, but
yeah,
it's something to consider. And it's a good question because it's important. I think it's important to have some.
Have you ever been in that
outside.
situation where you have to say no to something that you know is going to, like, not end well? Like, you know what I mean? So, like, have you ever been in a situation where you're not on call, but there is no one else to do it? Do you know what I mean? And you have to say no because that's your boundary, but then you leave this undone. Or do you be like,
Right.
yeah, I'm not on call, but I'll come in and do it?
That happens.
Yeah.
Mm-hmm. The latter part of what you just said happens. I don't know that I've flat out refused to, like, oh, too bad for them, send them somewhere else. Fortunately, in a city like ours, there are
Multiple.
a number of resources. So I don't think anybody's going to be totally left high and dry without a resource. So it's not really left to any one individual for a surgical case or an internal medicine case, because there are some resources.
Right.
But outside of a city like ours, I think that could be a reality.
I think
for
that could be
some.
really stressful on
Oh.
the person.
Yeah.
You know
could
what I
be
mean? On the
really
veterinarian.
It's a lot of
Absolutely.
responsibility, and
Yeah.
feel guilty when you have to
Have
say
to say
no.
no.
Yep.
Yeah.
Mm-hmm.
Do you find that because your wife is a veterinarian, so very familiar with the field, that was it easier or harder to set boundaries because she is aware of how our career works?
I thought it was easier
Yeah.
because
Okay.
she understood the
reasoning
behind it, and I didn't have to defend myself
Yeah.
nearly as much as I think another individual would.
Sure. Yeah.
So, plus she's awesome, and she's pretty understanding that way.
Yeah.
So she knew what we were signing up for
Yeah.
when I asked to go back to school. We were already married at that point.
Yeah.
And she graciously said yes.
Nice. Here you are. Okay, so
Because we all know how that works, right?
Yep.
Yeah. Exactly.
If you could do it all over again, would you pick the same specialty?
Absolutely. Yeah, I could not find myself in a different specialty, at least. But if I was forced to pick a different one, that'd be hard. I like aspects of radiology, but I would fall asleep in the dark room
Yes, exactly.
with the hum of the ultrasound.
How do those people do it all day long in a dark room? Oh, yeah.
Plus, I absolutely love the hands-on aspect
Yeah.
of surgery, and I find it's a good balance of client communication, using my brain, using my hands. And I often will tell my staff, the worst day in surgery is better than any day in another department. So that's my own joke. It's not a universal truth.
That's funny.
That's awesome.
So yes, I would pick the same one.
Okay, nice.
What do you think are important traits to have as a surgeon?
Well, I think everyone has a preconceived idea of what a surgeon's personality is like. That's why there's all sorts of jokes. But certain trait, I think, as far as intelligence-wise, like all veterinarians are intelligent. Like to get to that point, I think for a surgeon, there's some level. One thing is spatial awareness, and I think what I mean is having an idea of what you're looking at and its surrounding components. Because, for example, in surgery, you don't get the same view as you did in anatomy class because you don't have the whole thing laid open and bare.
Mm-hmm. But
just having a good understanding of the 3D structure of soft tissue or ortho stuff. So that I think is one aspect. A trait, it's not really a trait. That's more of an ability. I think a trait would be a decisive nature a little bit. And I think this is where there could be some level of arrogance in surgeons. There are a lot of times where we have to make an intraoperative decision and then be confident to make that decision and then do it.
Mm-hmm.
And so a fairly quick, decisive nature, I think, is pretty important because I don't have the ability to sit and research something and then write a paper on it and come back and make a decision, 2 days later. Oftentimes you're asking them to make a decision right now. And so that's one component, I think.
Mm-hmm.
And most of the time I'd like to say that you make the right choice.
Mm-hmm.
So some level of confidence in that. That'd probably be one.
Yeah.
Makes sense.
Mm-hmm.
Spatial awareness. That's the word I've been looking for.
Yeah.
It makes so much, especially I
When-
feel like with orthopedics, you have to have that like,
Yeah, it's like seeing past, like, like I could never describe, like when I was helping them in surgery or helping, and it's this, or, it's even like applicable, like in my mind, like when you're teaching someone how to put a catheter in and it's like, they're not running, like they're not like, I don't know, like, it's like everything's sitting in a certain place. You can't see it, but you have to visualize.
You have to visualize where the vein is.
Yeah. And where the thing is going that you're putting in the arm and what, and
you do.
And it's like, oh my gosh, like you can't just like look at the one spot you're sticking.
Yeah.
You know what I mean? Like this is a whole thing, like this running in this dirt, anyway.
That's hard to teach.
No. Yeah.
I think that it's a skill that can be learned to some degree. But
yeah, it's very, very, that's, yeah. That was,
mm-hmm.
especially just thinking abdomen wise, like where everything's at, like, yeah, spatial awareness, it's a good trait in general to practice, even if you're not a surgeon. I feel like it's just like, okay, well, I'm going to do a splenectomy, so envision where everything's going, things like that. But
there's one other trait, just when I'm thinking about it, is knowing your limitations too.
Mm-hmm.
It's like you mentioned earlier in our conversation, if I don't know something, I'm going to send it to someone who knows everything. Well, that's not exactly true either.
Right.
So I have limits. Other specialists have limits. And I think it's real important to know what you're good at and maximize on that. And then where I find myself pushing the boundaries of my limitations, it's okay to phone a friend, at that point.
yeah.
So I think that's a good trait, not just for this discipline, but for others.
Oh, absolutely.
Yeah.
Mm-hmm.
That's why there's so many of us. We phone a friend all the time.
Yeah.
Well, it
We
says a
work
lot
together
for
a
a
lot.
collaborative environment.
Yes,
Yeah.
absolutely.
I think that's important.
Yeah. So
Yeah, it's
helpful.
so much better for the clients too. I mean,
yeah.
Oh.
Everybody knows about cases. That's one thing that's really helpful. But then everybody, because how many times are you going to see, we have a zebra wall in the doctor's office, and so, you're only going to see these things periodically, you know what I mean? And so it's great if everybody then benefits from that experience. So
Yeah.
you have so many more brains working on it than just one brain.
Yes. Yep. Where are we at? Okay. What brings you the greatest joy when performing your job?
Ooh, that can be multifaceted. I think from a strictly a professional sense, like we all want to do well at what we're doing. And that's probably one reason why I do like at least elective ortho and a large amount of elective soft tissue too. You can take a definitive problem, intervene, and have it do well. And so what brings me joy is like coming back at the 2-week mark or the 6-week mark for the rechecks. Hey, how's it going? Great. I'm like, super. That just makes, I'm just so happy. It's but as a surgeon, you have to deal with complications as well and have to understand that. But from a joy standpoint, I do like seeing something go well, and a return to function is a big part of it, allowing the quality of life for these patients to get back to as near normal as possible.
Yeah.
Yep. I remember coming out of school, like the reality, it kind of hit me that probably in the first 2 weeks. I can't fix everything.
Yeah.
I was pretty disheartened. I was like, oh, this is upsetting.
Yeah. That's a challenge to be okay with. Like you acknowledge it and then you're like, well.
And some things you don't get the privileges of fixing. Because, you know what I mean? So, I mean.
Or you've literally done everything you can. You're like,
Yep.
You look at the client and you're like, I've done everything I could, those are the tough conversations, but.
It is.
But we're talking about joy.
Okay. That's right.
So when things go well.
What advice would you give to aspiring veterinarians and or technicians that may be interested in general, or just in surgery, or any advice you have?
All right. So, and if you're looking to go to veterinary school, maybe two big things. One is have the financial conversation with somebody.
Yes.
No one had that with me before. And then I married a veterinarian, and so I did that times 2. But it's a reality of it. And for some, it's a hard reality. So that would be one, at least topic to consider looking into veterinary medicine. Maybe I'll preface all of it with, this is a very rewarding profession. There's a ton of directions that you can go. And so also looking in for the veterinary student, don't be pigeonholed into a small, narrow, just because I don't understand what else is out there. Start talking to a lot of people, other professionals, find out what areas of veterinary medicine there are. Didn't you just mention pig AI?
Yeah.
Or there's I think Colorado has a congressperson that's a veterinarian. So there's all over the place, from working at CDC to politics to being a small animal practitioner. There's a whole variety of things.
Yeah.
So talk to a lot of people and develop some interests that way. I think in veterinary school, it's good to separate yourself a little bit because it's hard. It's a lot of material. So I had a goal of reading a non-veterinary related book once a semester, just to realize, hey, there's still a world out there that exists. So I think it's good to kind of keep yourself not from being so unbalanced in school.
Yeah.
I would also advise to consider an internship like we talked about. And specialty direction's not for everybody, but should think about that. Nice educated decision before saying no to that direction also.
What kind of books did you read?
I like nonfiction.
Okay.
I was on a World War II kick there for a while, early American history kick for a little while. Recently, some about like the Jim Crow era of the U.S. And it's like a recent book, The Warmth of Other Suns, was super interesting about mass migration of the African American community from the South to primarily San Francisco, Chicago, and New England. And that's neat.
You still read those books?
I do.
Nice. Nice.
Yeah.
We like books.
We do.
We do.
She does. I don't really read books.
Yes, you do when I assign them.
Yes.
Now I have a new book to read.
What'd you say?
Now I have a new one to read.
What
Yeah.
Chowder.
Oh, yeah, you do.
yeah,
Look at that.
Chowder
book.
Look
There
at
you
that.
go.
I like that. That's nice. Good job. Oh, gosh.
Wow. Well, I feel like there's so many other questions we could always still ask, you know?
Yep.
It's just so interesting to pick the brains of colleagues and
Yeah.
the experts in the field and all that stuff. But
Yeah. And we really appreciate you spending time with us.
Yeah.
I know you're busy and everything. So.
Oh, this is great.
Yeah.
I really appreciate the time.
yeah,
hmm
super fun.
Okay. Well, thank you so
Yeah.
much for tuning in to another episode of the Veterinary Roundtable. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
Woo!
Thanks.